Hi everyone, welcome back to my YouTube channel. Today we are going to talk about pulpitis, and here at the side you can see the diagrammatic representation of pulpitis for the reference. So let's start our topic with introduction. Pulpitis is inflammation of dental pulp, that is the soft tissue inside the tooth that contain nerves, blood vessels and connective tissue. It is a common dental condition usually caused by bacterial infection due to tooth decay, trauma or dental procedures. If left untreated, pulpitis can progress to severe pain, pulp necrosis, and infection spreading beyond the tooth. Definition of pulpitis. Pulpitis is defined as inflammation of dental pulp, which may be reversible or irreversible depending on severity and duration of inflammation. The condition is usually characterized by tooth pain, especially in response to thermal stimuli that may be hot stimuli or cold stimuli. Anatomy of dental pulp. Dental pulp is located in the central part of tooth within the pulp chamber, as you can see here in diagram, and root canals. It plays a vital role in nourishing the tooth, forming dentine, sensitive function that is pain response and defense and repair mechanism. Types of pulpitis. Pulpitis has reversible pulpitis and irreversible pulpitis. First type is reversible pulpitis. This is a mild inflammation of pulp where the tooth can return to a healthy state if the cause is removed. It is usually caused by early dental caries, minor trauma, or recent dental procedures. Symptoms of it include brief sharp pain triggered by hot, cold, or sweet stimuli, which subsides quickly after the stimulus is removed. Second type of pulpitis is irreversible pulpitis. This is a more severe and persistent inflammation of pulp that cannot heal on its own. The pulp becomes severely damaged, often leading to necrosis. Causes of it include deep caries, extensive trauma, or cracked tooth. Symptoms include spontaneous lingering pain, pain that may worsen at night, and sensitivity to temperature changes lasting longer than a few seconds. It often requires root canal treatment or extraction. Causes Causes include dental caries, that is the most common cause, as the bacteria penetrate the enamel and dentine to reach the pulp. Second cause of pulpitis is tooth trauma, that is injury from accidents or grinding that can as called as bruxism and that can damage the pulp. Third cause is dental procedures, as overheating or overpreparation during dental treatment can irritate the pulp. Fourth cause is restorative material, as some filling material can cause pulp inflammation. Fifth cause is chemical irritation, that may be from dental material or medication. Sixth cause may be cracked tooth that allow bacteria and irritants to reach the pulp. Now let's talk about pathophysiology of pulpitis. Dental pulp is encased in a rigid structure limiting its ability to expand when inflamed. When bacteria or irritants reach the pulp, they trigger an immune response leading to inflammation, increased pressure, and pain. In irreversible pulpitis, the inflammation is localized and can resolve. But in irreversible pulpitis, the continued inflammations lead to pulp death and can spread to surrounding tissues, causing periapical abscess. Clinical features of pulpitis. It includes pain that ranges from mild and short-lived, that is in case of reversible pulpitis, to severe throbbing and persisting pain in case of irreversible pulpitis. Second feature is sensitivity to hot, cold, and sweet substances. Third feature is discomfort on biting, especially in cases involving cracked teeth or advanced caries. Fourth feature is spontaneous pain that are typically seen in irreversible pulpitis. Diagnosis of pulpitis. Diagnosis is based on a combination of clinical examination and diagnostic tests. For example, it includes history and symptoms. There is patient description of pain type and duration. Second, we can do thermal test, that is by using cold or heat to assess pulp response. Third, we can do electrical pulp testing to check nerve response. And fourth, we can do percussion and palpation to evaluate sensitivity of the pulp. Fifth thing we can do is radiography or access to check for decay, trauma, or periapical involvement. Treatment for pulpitis. For reversible pulpitis, we can do removal of cause, that is caries or faulty restoration. We can also place a proper filling or restoration, and we can also use desensitizing agent or sedative dressing if needed. But for irreversible pulpitis, we can do root canal therapy, that is removal of inflamed or necrotic pulp followed by cleaning, shaping, and filling of the root canal. We can also do tooth extraction, that in cases where the tooth cannot be restored. And pain management, that is use of analgesics and sometimes antibiotics if infection is present. Complications of untreated pulpitis. It can cause pulp necrosis, that is death of pulp. It can cause formation of periapical abscess. It can cause spread of infection to jawbone or surrounding tissues. It can also cause tooth loss and systemic infections in rare cases. Prevention of pulpitis. It can be prevented by good oral hygiene practices like brushing and flossing regularly. It can be prevented by regular dental checkups and cleanings. It can be prevented by early treatment of cavities and trauma, by use of protective gear during sports, by careful handling of dental materials during procedures. Conclusion of this lecture video. Pulpitis is a significant dental condition that, if detected early, can be managed conservatively. Understanding the types, cause, and treatment options for pulpitis help in preventing irreversible damage to the tooth and surrounding structures. Timely intervention, proper diagnosis, and appropriate dental care are essential for preserving tooth vitality. And this was all about pulpitis. Hopefully you liked the video. If you do, don't forget to like, share, subscribe, and comment. Thank you for watching.